Welcome to an overview of disability and poverty. This discussion is brought to you by the Vocational Rehabilitation Technical Assistance Center on Targeted Communities, also referred to as Project E3, which stands for Educate, Empower, and Employ. Funding to support this project is provided by the Rehabilitation Services Administration. My name is Cayte Anderson, and I work at the University of Wisconsin-Madison. My colleague Tobey Partch-Davies from the University of New Hampshire and I will be working together today to co-facilitate this discussion.
Hello and welcome to today's webinar. My name is Tobey Partch-Davies and I work at the University of New Hampshire Institute on Disability. Disability and poverty are two topics I'm very passionate about. As a former job developer and now a researcher and evaluator, I've worked for many years in an attempt to reduce economic disparity among workers with disabilities through the use of Social Security and Medicaid work incentives, individual development accounts and household budgeting and credit repair, IRS tax credits, employment, and now ABLE accounts. It's a pleasure to be here with you today.
The purpose of Project E3 is to provide technical assistance to state vocational rehabilitation agencies and their partners, addressing barriers to VR participation in competitive integrated employment of historically underserved groups of individuals with disabilities. These groups are defined as residents of rural and remote communities, adjudicated adults and youth, youth with disabilities in foster care, individuals with disabilities receiving federal financial assistance, specifically temporary assistance for needy families or TANF, culturally diverse populations, high school dropouts and functionally illiterate consumers, persons with multiple disabilities, and SSI and SSDI recipients and beneficiaries, including sub-minimum wage employees. So the outline for our discussion today involves a basic overview of disability and poverty, some definitions, also a brief look at the research. What is the current research telling us from behavioral economics and neuroscience? Social determinants of health. What does this mean and why is it important? The Workforce Innovation and Opportunities Act, WIOA and poverty. What do we need to know about this and how do these align? And finally, probably the most important piece is what can I do about this? How can I take action to integrate some of this information into my... So let's start with some basic background on poverty and defining poverty. There are actually a number of definitions related to poverty in existence. However, we tend to use what's referred to as the federal poverty level, which is defined by the federal government. It is updated annually and published in the Federal Register, typically mid to late January each year. So the figures you see in front of you right now represent the 2018 federal poverty guidelines, and this represents 100% of the federal poverty level, or what people refer to as the poverty line. So as an example, in a family unit size 1, so one individual in the household, in the family, in the 48 contiguous states and the District of Columbia, this equates to $12,140 per year, or $1,012 per month. The amount is higher in Alaska and Hawaii to account for the higher cost of living in those states. But when you look at that figure of $12,140 a year, or a little over $1,000 a month, it's pretty clear to see that that is not a lot of money to live on when you think of the expenses that most folks have, including rent or mortgage, so the housing expenses, utilities, transportation, food, clothing, etc. So in thinking about the individuals that you work with, what percentage would you estimate are living at or below the federal poverty level? So approximately what percentage of folks have income of about $1,000 a month or less, if it's a household of one? It's actually kind of a humbling concept to think about. And when we pose this question to groups of vocational rehabilitation professionals, rehabilitation counselors, typically the response that we get is that most professionals estimate that at least 90% of the individuals on their caseload are probably living at or below the federal poverty level. We've borrowed this infographic from our colleagues at the National Disability Institute. They do very nice work in the area of disability and poverty as well. And they have extracted data from a variety of sources, but specifically the Census Bureau, and have developed this nice infographic to depict some of the disabilities and poverty statistics. So we know that adults with disabilities are twice as likely to live in poverty as those without a disability. We also know that women with disabilities are more likely to be living in poverty than men. The disparity in poverty rate between people with and without disabilities grows with age. We also know that as educational levels increase among people with disabilities, the poverty rate declines. We also know that people of color with and without disabilities are more likely to be living in poverty than the non-Hispanic white population. Unfortunately, this is a stubborn statistic that has persisted over time, but it also illustrates part of the underpinning and the reasoning behind a technical assistance center that is specifically focused on targeted communities. The goal, again, is to help change some of this. Now, interestingly, when we look at the banking behaviors of individuals with and without disabilities, but specifically today we'll be focusing here on people with disabilities, 46% of households that are headed by an adult with a disability were unbanked or underbanked in 2013, compared to 29% of households headed by an adult without a disability. So what does that mean? Unbanked is typically defined as individuals do not have a formal relationship with a financial institution. So that could be a bank, a credit union, or another formal financial institution. Underbanked means that they may have a formal relationship with a financial institution, but are really underutilizing the various options and financial options available to them. And that could involve credit, lack of credit, no credit, poor credit, etc. 18% of households headed by a working age person with a disability were unbanked, while 28% were underbanked. 47% of households headed by working age persons with a disability were significantly more likely to report using alternative financial services, such as payday lenders. And additionally, 47% of households headed by working age persons with a disability were significantly less likely to have a savings account compared to their counterparts without disabilities. So we're sharing some of this today. We're not going to be doing a deep dive into financial empowerment. We'll have a discussion on that issue in the near future through this TA Center. But we just wanted to present this information. NDI has done a nice job, again, pulling it together into this infographic, and it fits very well with the discussion on disability and poverty. So as we noted earlier, defining poverty can be a bit tricky. It is a complex construct, but today we're breaking it out into two primary definitions of poverty. So situational poverty occurs as a lack of resources due to a particular event. So specifically, an individual is injured or acquires a disability, develops a chronic illness, experiences divorce, death of a family member or spouse or parent, etc. Situational poverty is really tied to a specific event and or time frame. Generational poverty is defined as a lack of multiple resources for at least 2 generations. However, the patterns can emerge and begin to surface much sooner if the family lives with others experiencing generational poverty, which is very common. So generational poverty, just think of that in terms of multi-generation poverty. And again, many of you can probably think of folks that you work with and individuals on your caseload that are experiencing multi-generation poverty. It's within the generational poverty that we start to see emergent disability. And emergent disability really comes from the educational literature more so than the rehabilitation literature. But emergent disability is when children who are born into families that are experiencing multi-generational poverty are at higher risk for developing disability themselves. Scarcity and stress. Scarcity is distracting. What is scarcity? Scarcity involves a lack of intention, time, money, oftentimes commingled. These fit together in many cases. But scarcity in managing very limited resources actually requires increased attention and more self-control, which can lead to depletion. In other words, it can actually take more time and energy to manage fewer resources because you're trying to stretch that dollar farther. You're trying to figure out how to take 3 buses or transfer twice to go pick up your child from school and then bring that child to a caregiver and then still get to your shift on time. It takes a lot to manage very few resources. And depletion is really the effect of dealing with scarcity over time and longer term. Depletion is stressful in and of itself. So scarcity actually can increase the stress and is another stressor in and of itself. It's associated with poor decision making, and oftentimes you'll see this in practice as a focus on the current short-term problem, not focused on longer-term future issues, may avoid longer-term planning, etc. And kind of what we would otherwise say kind of survival mode. So a focus on very short-term goals or needs. So now shifting into some of the contemporary research in this area, we're talking about disability and poverty. It's really interesting to look at the behavioral economics research. And I'm not sure, many of you might be familiar with this body of literature, but it's a relatively new field and really blends the fields of psychology and economics to help study, learn, and explain decision-making and specifically financial decision-making. So we have a link here to a study that was published not long ago, and it's a pretty easy read. It's interesting. It's in Harvard Magazine. But essentially two researchers, an economist at Harvard and a psychologist at Princeton, decided to collaborate. And they pulled together years of findings from the fields of psychology and economics and added their own empirical research to this. And the analysis that they were looking at, or the research questions that they had, is that they wanted to learn if scarcity, so again, scarcity, that lack of resources, if scarcity steals mental capacity. And again, whether that is you're poor, you have a lack of income, you're hungry, lack of food, lonely, lack of social connections, or time-strapped, or all of the above. So what did they find? The researchers found that poverty depletes cognitive resources, therefore leaving little space for making everyday decisions around parenting, school, work, etc. In other words, it takes more time and energy to manage fewer resources. They also found impulsive behavior, poor performance in school, and what presents as poor financial decision-making may actually be products of a feeling of scarcity. They noted that just thinking about scarcity taxes the mind and increases stress. Low-income parents are also at far greater risk for depression and anxiety, which is also discussed as poverty's mental tax. They noted that when parents are distracted or depressed, family life may be characterized by conflict and emotional withdrawal rather than nurturing and supportive relationships with their children. And finally, and this might be the most interesting piece, finally, they noted that policies and programs need to consider scarcity-induced behavior in their design. So our programs traditionally focus on the individual, so the pilot, and they are suggesting that instead of putting the onus on the pilot, perhaps our systems and programs need to look at redesigning our cockpit or the systems designed to serve these individuals to help improve some of the outcomes. So some additional research that's interesting to look at is in the field of neuroscience. And again, another study that was published not long ago, and this is widely available. You can even find clips on YouTube if you'd like a quick version of this, or to hear the information from the researchers themselves directly. But two neuroscientists, one at Columbia University and one at Children's Hospital in Los Angeles, collaborated, and they imaged the brains of 1,099 children, adolescents, and young adults in several cities across the United States. They controlled for genetic ancestry and some other factors in order to isolate the effects of poverty. So what they were really looking for was to focus in on poverty itself and the effect of poverty on the brains of these children, adolescents, and young adults, and whether or not there was a difference. So what did they find? They found that family income is significantly correlated with children's brain size. They also found that income disparities of a few $1,000s were associated with major differences in brain structure, specifically language and decision-making skills. Test scores measuring cognitive skills such as reading and memory ability also declined as parental income declined. And interestingly, and this is the point that I think is actually the most exciting, increases in income were associated with the greatest increases in brain surface among the poorest children. And specifically, they found that increases in household income of about $4,000 in households that predominantly had overall annual household income of $25,000 or less, if they could increase that household income by about $4,000, there were significant positive brain changes subsequently recorded with those children. So what does that mean? I think I put on my vocational rehabilitation hat for a moment and think about this as a rehabilitation counselor. Our public VR programs are perfectly situated to help these individuals and families. We know employment. We know how to help people find employment, how to keep employment, how to grow their careers, etc. We can help with this. So if you are a rehabilitation counselor or someone working with individuals with disabilities and employment, consider yourself part of the potential solution and part of the promise with this particular area. Additionally, there's further research documenting the relationship between financial stress and its association with poor health. We also know that mental health and debt are associated. As we discussed earlier with the construct of emergent disability, hardship experiences themselves can lead to poor health and disability, and sometimes what we refer to as secondary health conditions. So as an example, something that may be a condition that may be very treatable, but if an individual does not have access to proper treatment or health care or health coverage, the treatable condition could then become a disability itself. So essentially a secondary health condition is a treatable condition that if left untreated can result in a disability or become a disability. And then we certainly know that the relationship between poverty, disability, and health is often cyclical. And we tend to see this pretty prevalently with the generational or multi-generational poverty. And with that, I'm going to turn it over to Dr. Partch-Davies, and she'll tell us a little bit more about the social determinants of health.
Social determinants such as economic or political conditions that characterize individuals and communities also play a role in poverty and the persistence of poverty. income inequality, local economies, educational status, quality of housing supply, and public infrastructure such as access or lack of access to transportation systems, technology, food stores, banking products, personal care, and self-advocacy supports needed to exercise rights and control over livelihoods are some examples. The geographical makeup of community and its culture is also very important. Rural, urban, and suburban centers have their own unique challenges. In these cases, again, what is the infrastructure available to persons with disabilities? What are the social attitudes about people with disabilities and/or culture, ethnic, or linguistic minorities? All of these factors interact and affect financial security, socioeconomic status, and health, and necessitate not only, as a counselor, helping to address individual barriers to employment, but also necessitate vocational rehabilitation systems to address community-level structural impediments to opportunity in local communities.
So why do rehabilitation counselors and other professionals need to understand the disability and poverty connection? First, we need to develop a better understanding of the intersection between disability and poverty. And we use that term very intentionally. Intersection, referring to social justice, intersectionality, but understanding that disability and poverty can be deeply interwoven. Based on our earlier part of the discussion, we know that individuals with disabilities are less likely to be employed and are more likely to live in poverty than any other demographic group. We also know that individuals with disabilities are disproportionately represented in higher numbers among those who are living at or below the federal poverty level. We also need to be aware of this, the connection between disability and poverty, to improve our cultural competence. And despite the fact that almost 2/3 of adults living in long-term poverty have disabilities, poverty and disability have historically been treated as separate issues, addressed by separate advocacy groups and separate governmental programs. However, the reality is that disability and poverty work to reinforce one another and perpetuate inequities and inequalities across systems. So we really do need to understand this from a cultural competence perspective, and what we were talking about with some of the behavioral economics, in terms of redesigning some of the programs, or rethinking and redesigning some of the programs that we work in, considering those the cockpit. We need to understand this connection in terms of the implications for service delivery, and I think that ties to the previous point pretty well. Also, we cannot have discussion around poverty or addressing poverty issues without actively talking about employment and financial empowerment. So employment, again, public vocational rehabilitation professionals are experts at employment. Financial empowerment, we'll have, as I mentioned before, we'll have another discussion around financial empowerment. But financial empowerment is another key piece of the puzzle. You get a paycheck, but what do you do with the paycheck? How do we help folks build strategies and some planning tools in a culturally appropriate way that also recognizes multi-generational poverty issues and realities? And also, of course, WIOA and poverty. So the Workforce Innovation and Opportunity Act of 2014, WIOA, focuses specifically on serving younger individuals, which is important. As we talked about earlier, the concept and construct of emergent disability is really key. And I think this is where WIOA, it's taken some structural change and a considerable amount of work within our state programs to make adjustments to better serve younger individuals, those that are eligible for VR services and those that are potentially eligible for services. But really, consider it a sound investment. If we can work with individuals with disabilities starting at younger ages, and specifically those that are also experiencing poverty or living in multi-generational poverty households, we have an opportunity at early intervention to help change the trajectory of those lives. WIOA also places an increased responsibility on VR programs to engage and employ, or successfully employ individuals representing the historically underserved populations. And with this, for a minute, I want you to think about the RSA 911 data elements. So the data that we gather and input on with each of the individuals that we serve in our programs. The number of data elements about doubled with the advent of WIOA, which I know was considered to be a burden by many, and I don't want to downplay this because I know it does take a lot of additional work. But when you take a moment and look at the data elements itself and some of the additional data elements, they really hone in on the poverty factors. And some of what we were discussing earlier today in terms of the demographics and who is represented or disproportionately represented among those that are living at or below the federal poverty level. If you think about that and then look at the 9/11 data elements, you will see a lot of alignment there. So those are really important to take seriously and report on accurately. Under WIOA, we're now taking a longer-term look at employment and earnings outcomes. Historically, we had the 90-day closures, and now we need to look at employment and earnings outcomes at quarter 2 and quarter 4, which is also represents a commitment to looking at employment as a longer-term commitment with the individuals that we serve. Because we know that if we get somebody employed at 90 days and boom, they lose their job, there's really not much of a chance that that person is going to be increasing their overall annual income. So I think that longer-term look is important. And also, finally, that collaboration with other programs, also serving low-income individuals with disabilities. Now, within the public VR program, everyone that we serve, everyone who's determined eligible, does have a disability. We know that many of the other partner programs also have high incidence of disability, but they may or may not have the knowledge, expertise to appropriately serve some of these individuals. So I think the collaboration piece is going to be key, not just in terms of VR assisting partners, but partners who may be working with individuals that also represent these underserved populations that could benefit from VR services. So what can I do? As rehabilitation professionals, we just provided a lot of information across a variety of different aspects of disability and poverty. So what do you do with this? And how can you take this and put it into practice? I think the first point is probably pretty simple, but we simply encourage individuals with disabilities to consider employment. Vocational rehabilitation is an employment program, and we really can't have discussions about disability and poverty without employment being at the heart of those discussions. So again, encouraging folks to consider employment. You can also share information about your state's vocational rehabilitation program. The myth persists that we are the best kept secret, and we shouldn't be. There's no reason for VR to be a secret. Actively and openly share information about your state's program. Make sure you have a good website that is, clean and accessible. Your literature is clean and easily available to those who want it. For state program staff, we encourage you to review your application process to determine whether information about your program is easy to find. Do you have an online application process? Can people apply over the phone? How accessible is your application process, and how easy is it to find that information? Is the information about your program clear? Again, about VR being an employment program. You want this point to be crystal clear in all of your materials, your messaging, conversations, etc. I know that over the years, we tend to have folks that apply thinking that we are the place to come to get a vehicle or college education paid for. And it's not to say that we can't do that, but it all needs to be tied to a clear employment goal with clear outcomes, because we are an employment program. Are our materials clear, transparent? Do we have timely application and eligibility processes? We know that folks tend to drop off between application and eligibility determination if it's not done quickly enough. The 60-day window really shouldn't be the norm. That's really the outer window on how long it should take. Most of the time, eligibility determination should take much shorter than that. And also, our VR program, is it known and understood by colleagues in related areas that also serve individuals with disabilities who may be living at or below the federal poverty level? Colleagues in our schools, TANF programs, etc. It's important for these folks to have a basic understanding of the public VR program, how to assist individuals in applying, etc. So if you feel like colleagues in some of these programs are not familiar with VR, we encourage you to reach out and develop a basic presentation. Honestly, even an elevator speech can be helpful with a few bullet points about what is VR, how do people find your information, etc. And finally, if you found this discussion today to be helpful or interesting and you'd like to continue the discussion and or access some of the resources that we referenced here, we encourage you to join our online community of practice. It's an opportunity to discuss, learn, share resources with colleagues from around the country. And we will be continuing to, there's a number of resources currently available in the COP, but it's a great forum to be able to take this discussion and continue it online. Thank you very much for joining us today. We look forward to continuing the discussion with you in the online community of practice and look forward to chatting with you there. Thanks.